Understanding the Triangles of the Neck, an in-depth exploration. Good day, listeners, and welcome to the Everything Surgery podcast. In today's episode, we'll be taking a detailed look at the anatomical triangles of the neck, essential regions that clinicians use to organize and understand the complex structures of this vital area. Whether you're a student, a medical professional, or simply curious, this podcast will guide you through the essential anatomy, boundaries, and clinical significance of each triangle. Let's dive in. The triangles of the neck. Overview. The triangles of the neck serve as anatomical landmarks, helping us navigate the intricate network of muscles, nerves, vessels, and glands found within this region. They are primarily divided by the sternocleidomastoid muscle into two main sections, the anterior and posterior triangles, each with their own further subdivisions. 1. The anterior triangle of the neck. Let's start with the anterior triangle. Its boundaries include the midline of the neck, anterior, the anterior border of the sternocleidomastoid, posterior, and the inferior border of the mandible, superior. The roof is formed by the platysma muscle with the superficial fascia, and the floor consists of the pharynx, larynx, thyroid gland, and hyoid muscles. Within the anterior triangle, we find four smaller triangles. A submental triangle. Boundaries. Medially by the neck's midline, laterally by the anterior belly of the digastric muscle, and inferiorly by the hyoid bone. Key contents. Submental lymph nodes, which drain the floor of the mouth and tip of the tongue, as well as small veins that form the anterior jugular veins. B submandibular, digastric, triangle. Boundaries. Superiorly, the inferior border of the mandible, anteriorly and posteriorly, the respective bellies of the digastric muscle. Key contents. The submandibular gland, submandibular lymph nodes, facial artery and vein, hypoglossal nerve, cranial nerve 12, and the mylohyoid nerve. See carotid triangle. Boundaries. Superiorly, the posterior belly of the digastric muscle, laterally, the sternocleidomastoid, and inferiorly, the omohyoid muscle. Key contents. The common carotid artery, which bifurcates into internal and external carotid arteries, internal jugular vein, vagus nerve, cranial nerve 10, hypoglossal nerve, cranial nerve 12, accessory nerve, cranial nerve 11, as well as the carotid body and sinus. D muscular, omotracheal, triangle. Boundaries. Anteriorly by the neck's midline, superolaterally by the superior belly of the omohyoid, and inferolaterally by the sternocleidomastoid. Key contents. The thyroid gland, isthmus over the trachea, esophagus, and the recurrent laryngeal nerve 2. The posterior triangle of the neck. Moving to the posterior triangle, we find it bounded anteriorly by the posterior border of the sternocleidomastoid, posteriorly by the anterior border of the trapezius muscle, and inferiorly by the clavicle. Its roof is formed by the platysma, superficial fascia, and skin, with the floor consisting of the splenius capitis, levator scapulae, and scalene muscles. The posterior triangle can be further divided into A. Occipital triangle, upper part. Boundaries. Marked inferiorly by the inferior belly of the omohyoid. Key contents. The accessory nerve, cranial nerve 11, cutaneous branches of the cervical plexus, occipital artery, and lymph nodes along the nerve. B. Supraclavicular, subclavian, triangle, lower part. Boundaries. Superiorly by the inferior belly of the omohyoid. Key contents. Subclavian artery and vein, brachial plexus, roots and trunks, external jugular vein, and supraclavicular lymph nodes. Clinically important, especially in cases like varicose node for gastric cancer metastasis. 3. Clinical significance of neck triangles. Why do these triangles matter? Let's break down their clinical relevance. A. Surgical and diagnostic importance. The carotid triangle is a key site for carotid pulse palpation and endarterectomy procedures. The posterior triangle is often used for brachial, plexus blocks and lymph node biopsies. The muscular triangle is the region of choice for thyroidectomy and tracheostomy. B. Associated pathologies. Lymphadenopathy. Enlarged nodes in the submandibular triangle may point to oral infections or malignancies, while those in the supraclavicular triangle, like varicose node, can suggest metastasis from cancers such as stomach or lung. Brachial plexus injury in the posterior triangle can result in conditions like Erb's palsy, waiter's tip posture or Klumpke's palsy, claw hand, carotid artery disease. involving atherosclerosis, increases stroke risk and may require carotid endarterectomy. Accessory nerve damage during neck dissection surgeries can lead to trapezius muscle paralysis, affecting shoulder movement. Summary table. Triangles of the neck. Let's wrap up with a quick summary. The submental triangle is bordered by the anterior belly of the digastric muscle, the midline of the neck, and the hyoid bone. Within this area, you'll find the submental lymph nodes and the anterior jugular veins. The submandibular triangle is defined by the mandible and the anterior and posterior bellies of the digastric muscle. Its notable contents include the submandibular gland, the facial artery, and the hypoglossal nerve. Cranial nerve 12. The carotid triangle is bounded by the posterior belly of the digastric muscle, the sternocleidomastoid, and the omohyoid muscle. This region houses the carotid artery, internal jugular vein, vagus nerve, cranial nerve 10, and the hypoglossal nerve. The muscular triangle is formed by the midline of the neck, the omohyoid, and the sternocleidomastoid. It contains the thyroid gland, the trachea, and the recurrent laryngeal nerve. The occipital triangle is bordered by the sternocleidomastoid, trapezius, and omohyoid, and it contains the accessory nerve, cranial nerve xi, and branches of the cervical plexus. Lastly, the supraclavicular triangle is situated between the omohyoid, sternocleidomastoid, and the clavicle, and contains the brachial plexus and subclavian vessels. That concludes our comprehensive look at the triangles of the neck. Thank you for tuning in. Be sure to subscribe for more in-depth explorations of anatomy and surgery, right here on our channel.